Hey child, and welcome back to Endo Speaks, where I talk about our Heavenly Father, living with endometriosis, and my life as a single mom. So I have had 3 surgeries so far. My first one was not for endometriosis. It was actually to remove a cyst that was on my ovary. At this time, I did not know that I had endometriosis or what it was. My doctor did not think prior to my surgery that I could possibly have endometriosis. She just thought that the pain that I was having was coming from the cyst. So after the surgery, or during the surgery, of course, she, realized that I could possibly have endometriosis. She tested it and everything, and it came back that I did in fact have endometriosis. And that surgery was in November of 2015. Okay. My second surgery was in November of 2016. And in that surgery, I had my right ovary removed. That is because that's where all of my pain was on my right side. And it just kept coming back on that right ovary. And so another doctor from the same practice figured that removing that ovary would help with the pain and with my endo. So they removed a lot of the tissue associated with endo. And that was my second one. Now, I didn't have a lot of issues recovering from my surgery. I was off work from my first surgery for 3 weeks. And my second one, I was off for 2 weeks. My recovery time was fine. I pretty much laid around for a week. And then the next week I was up doing things, just take care of things as normal. I was fine. They are very small incisions on your stomach, or in your belly button. That's where one of mine is really close, like right up under my belly button. So they're very small. I have like 6 or 7 incisions around my stomach. But I'm not going to make it seem like it was horrible or it was like, because it's not. It's a very simple surgery for me anyways. And it was quick. I didn't stay in the hospital. I was outpatient. And I recovered fine. Like, it was nothing. Now, my third surgery. Let's talk about her for a minute, okay? I do have pictures and I will insert them. And from the pictures, you can see that it's webs within there. Like, it looks like webs or whatever. And that's all of the endo. All of that endo tissue that they had to remove. Now with this surgery, she used some of the old incisions to go in, and she so it was about the same amount of time or anything. Nothing different with the time or with the surgery itself. That was all normal and fine. But my previous 2 surgeries, I would wake up from, them putting me under, and I would quickly get dressed and I would leave. But this one, I woke up and I was laying in the bed, and my stepmom was in there. I'm like, what? Why? First of all, why are you in here? I'm supposed to get dressed so we can leave. So I didn't know what was going on. And then, so from whatever reason, they told me that I had to use the bathroom before I left. So I'm like, this has never happened. This is my third surgery and I've never had any issues with anything. So I'm like, okay. And I guess I was not peeing enough. So I was holding on to a lot of that still in my bladder. And so for that reason, I did have to stay a night at the hospital. She did tell me that I had tissue all over my bladder. Now, so that could be the reason as to why my bladder was acting so funny and not releasing all of my urine. So I did stay in the hospital for a night that time. And so by the morning, I was going to the bathroom as normal. My bladder wasn't holding on to any urine or anything, so everything was just fine. So I went home, and this recovery did take a little longer. I was still off of work for 2 weeks, but the pain did linger around for a little bit longer. My stomach was in more pain than what it normally was in, but the recovery time as far as going back to work and everything was 2 weeks. It was normal. So yeah, I don't know what that was all about. But I'm not going to scare anyone with the surgery because it's simple and it doesn't take long to recover at all. But thank God for my stepmom and my dad because they, I will go over their house after each surgery and they took great care of me. So thank you for that. But yeah, there's not really much to say about the surgery other than everything went well. It's not a scary surgery at all. It's very simple, very straight to the point, and they get you in and they get you out. Okay. Let's move on to my medications that I have taken. Okay. Now I have taken a few different medications for this endometriosis. The first thing that my doctor tried me out on was a shot called Lupron. Now, Lupron puts you in temporary menopause. Yes, menopause. And for that reason, I was a little nervous. Like, girl, I am in my 20s. Don't nobody want to deal with no temporary menopause. What? But I decided to do it anyways after I thought about it for a little while because my pain was bad. And I was like, girl, I am not. Who about to deal with this pain? Not she. So I decided to get it. I think it's a shot that you get. I cannot remember because it was a few years ago. I believe you get it like every 3 months or so. It could be once a month. I don't know. But so I got this shot. I think it was like every 3 months because I don't know. But anyway, so I got this shot and it really did put me in menopause. I was having the heat flashes. It was horrible. It was absolutely horrible. Like I would just break out in sweat. Like y'all ain't hot. I'm burning up. Like it was bad. But the reason as to why I only got 2 shots was because I gained over 30 pounds with this shot. No, boo. That's not how we work around here. So I quickly told her, no, let's move to something different. I can't do this shot no more. So I only got 2 shots of the Lupron shot and that was it. And then, what was next? I tried birth control next. See, previously to all of this, after I had my daughter, I got the Depo shot and that made my hair fall out and made me gain weight as well. So that was one that she suggested and I was like, no. So she put me on the pill. Now, I don't remember what it was called. I didn't honestly know that there were so many different birth control pills out there. So the one that she put me on had horrible side effects for me. My hair was thinning. And I was gaining weight. And I told her that, and so I guess she lowered the dosage or something. Because that pill that she put me on after that other one, it worked. I didn't notice any weight gain. I didn't notice any side effects at all. So that one was great. But after my third surgery, she told me about Orissa, I believe is what it's called. Please don't quote me on that. I think it's Orissa. And it's a little pink pill that you take every day, and it's supposed to help with endometriosis. Now, when I first started taking this pill, it gave me headaches. Headaches is a side effect. And I mean like very bad headaches all day long, nonstop, no matter what I took. And I just couldn't take it anymore. But I did. I continued to take the pill for a year, I believe. And I didn't like it. I didn't like it at all. If you are trying to conceive while on endo, you should not take that pill because it's a lot of times results in miscarriages. It just, yeah, I didn't like it at all. So last year I told her that I did not want to get back on that pill. And so I'm currently just on birth control. The birth control pill is working fine. It takes me off of my cycle for like 2 months, 2 to 3 months, and then I have a cycle, and so like that for every year. I mean, all year. The point of the birth control is to stop your cycle, to help stop your cycle, so that you are not having a cycle every month, which will reduce the buildup of the tissue. So those are all the medications that I have tried. She's tried to get me to do other birth control methods, but I am just not here for it. So I will just stay on the birth control pill for as far as I can take that. But again, I am taking out everything of my diet, and I am adding in a lot more days of working out so that I can see how this affects my body. And if this helps with my pain and with everything, then I will be coming off of my birth control as well. Because in the long run, birth control can mess up your body as well. And with already having endometriosis and knowing that it could cause fertility issues, I don't want to mess up my body any further with any medications or anything, that could prevent me from, having another child. So yeah, so that's it. Like, yeah, there's not much that they really know about endometriosis. There are not too many treatments or medication for us to really take, other than just natural things, eating right, working out, and just taking care of yourself. I think it's probably the best thing to do for endometriosis, finding what helps you manage your pain, your symptoms. So yeah. So I thank you guys for watching my video today. Like, comment, and please subscribe. I will see you guys in my next video. Bye, everyone.